The essential role of nurses in quality, safety, and healthcare services. It should be noted that the nurse is the closest person to the bedside. And when we are talking about the nurse being the closest person to the bedside, what are we talking about? Here, this includes changing of soiled linens, feeding of the patients to those that are bedridden or can't feed themselves, delivering of medication, attending to the patient's every need, monitoring of vital signs, and totally being the listening ear, going there, getting to know the patient in a little bit more detailed form, so as to be able to assist and to evaluate and make our assessment a little bit easier for the continuation of the patient's care. So you should understand that in the healthcare setting, while the administrators are in their office struggling to make sure the supplies, the needs of everyone, including the healthcare personnel and the patients, are met, while the doctors are in their offices consulting, meeting new patients, and trying to see to diagnose to give the correct diagnosis, and to send those that are going home and those that are to be admitted. The nurse, on the other hand, is seated in her own office, receiving the new coming patients, discharging those that have been discharged from the hospital, and making sure that everyone that is coming in is well seated, is well placed, their beds are clean, their bedsides are okay, the beds that they are being put on, the linens are clean, they are well organized, their blankets, if they are feeling cold, do they want to eat, where they will have that food, the medications that they receive, that they are going to receive, is being served. And each and every one of these duties is one of the things that we as nurses are supposed to deliver to our patients. And now, you being a student nurse, it might be difficult because, especially here in Cameroon, the schools, many schools out there do not see the need for a nursing practice teacher. And to other schools, they might finally get a nursing practice teacher when they are about to write. Imagine the course in your curriculum. The course for nursing practice is a 90 hours course. That simply means that it starts from level 100 to 200 and to 300, and it ends on the day that you're coming back from your practicals, and probably beyond. Because your nursing practice is the one thing you're going to rely on for the longest period ever. And you could see that student comes to the hospital without having any knowledge on what is expected of them, what they are going to do, how they are going to do it, with whom are they going to work with. As nurses, we spend most of our time with the patient. We spend time with them, taking care of their every need. That is our duty. And we are supposed to do that happily, because if you spend all these 3 years or 4 years going to school to be a nurse, then what you are telling yourself is, I'm going to spend my time at the services of the patients and of the client that comes your way. Now we are going to look at what you are going to be doing actively at the bedside. Number one, you are going to carbolize the beds and make sure that the previous patient that left that bed and the new patient that is going to come on that bed are completely safe from nosocomial infections. That simply means they are not going to come from home with malaria and then go back home with syphilis, with chlamydia. They are not going to leave their house with gastroenteritis and then go back home with HIV. Because nosocomial infection mostly happens in the hospital if we do not handle the care and the safety of the patient in the right and appropriate manner. And that is why we start from our beds. You must carbolize your bed before and after a patient gets onto it. When the patient leaves that bed, you must carbolize the bed and make sure that the bed is disinfected. And you must prepare your solution for carbolization correctly. That will be for another day. You keep your bed to dry off, and then you arrange and clean the bed in a beautiful and wrinkle-free manner. Because bed sores is one of the assessments that we are going to be giving certain patients to make sure that they don't come to the hospital with a good skin and then they go back with broken skin or with sore buttocks. We equally, on the bedside, we give supplies to the patients. A bedpan, a blanket, or any other thing that they basically need to make their stay in the hospital a beautiful one. In my place of work, we are having warm water. So we serve the patient warm water in case they want to bathe. You need to tell the patient in the morning, good morning, how was your night? And the person was like, okay, I slept good. Please, there is warm water outside. If you want to have your bath, just indicate and somebody will get you warm water so that you can have your bath. In case you know where the warm water is, which we are going to direct, you can get yourself some warm water and then you have a bath. We monitor or we check vital signs every morning and every evening. So you check the patient's vital signs or you monitor the patient's vital signs, and then you are able to assess what is the progress. The patient came to the hospital with a temperature of 40 and now they are having a temperature of 37. That is a good progress. The patient came to the hospital with a temperature of 37 and now the patient's temperature is 40. That is a call for concern. What is happening? What is that one thing that is different from what you have been doing? That now we are seeing that there is an increase in temperature of this patient. You need to be capable to see that this individual can leave the bed and come back on bed, so there will be no problem for them going to get themselves food at the canteen. If they can't, where is their carer? Do they have a carer that is going to sit by their side in case something happens so that they can notify the nurses? Do they have somebody that can help them with food? Are you going to be the one to feed them? Is this individual on an NG tube, or are you going to actively be there for them to monitor them on hourly basis, 30-minute basis, or 15-minute basis? It depends, and that assessment is one of the most important things that you have to do as you admit that patient in the hospital. If the patient came back in the state, if the patient came to the hospital in a state of a coma, what do we do? How do we arrange the bed to make sure that this individual do not have bed sores? So these are certain preparations that as a nurse you have to go through. The delivery of medications. You are the one to deliver medications to the patient. You have to save medications to this patient. So you must be aware. You must know your role. You must understand that all these series of things are the beautiful and a complement of everything that makes up a nurse. You are equally, being a bedside nurse, it is your potentials to identify any gaps. And when we are talking about any gaps, we are looking at those moments, or we are looking at those aspects that probably the doctor did not realize, or the changes that occurs after the patient has been put on bed. Because take note that most of these patients do not feel like, or do not actually tell the doctor everything that is wrong with him. Now, mama came to the hospital because she is having fever or she is having abdominal pain, and that is what she tells the doctor. I'm in this hospital because I have abdominal pain, and did not tell the doctor that I equally have been bleeding for the past 1 week or 2 weeks, because according to her, the community people had identified that or had diagnosed that to be pelvic inflammatory disease, and she is now on treatment, but she's just here because there's an additional abdominal pain. So within your own period of communicating with them, you realize that there is a gap. There is this misinformation. There is something that is very vital and very important that this individual, that the patient did not tell the doctor. And as a nurse, you now come to fill in this gap by relaying the remaining information that is very much needed for the patient. And when you relay that information, there is a new diagnosis that will be made, and this probably will be the key that is going to help that patient live a good and happy life. So being a student and being that one person that probably has the ability to keep moving in and out of wards and seeing patients, please spend some time with the patient, spend more time with the patient and get to understand them, because they might be able to disclose to you those informations that were not disclosed. Next, she told me while talking with the patient, she said she has been having cough for the past 3 weeks or 1 month. But the only thing she told the doctor when she came into the hospital is that she's having headache and she's feeling palpitations and all that. We had none. We did not realize that she has been having heavy night sweating. You get to diagnose that, and then we now recommend a sputum test or culture, and this patient was identified or diagnosed of tuberculosis. That is something that we did not know, and this individual has been in the ward. So you play a vital role, and those bedside duties should not be something that you feel like, okay, the only duties you have is to go serve medications, the only duty you have is to change their linens if they are dirty, or cabilize the bed when the patient is leaving, or arrange the beds in the morning. No, actively go in and do something that is wonderful for the patient. Be that listening ear. Serve them some time. Get there and ask them if they need to talk to somebody. Get there and ask them if they need a friend. And you become that friend, and you are going to be able to break some of these boundaries. And when these boundaries are broken, the patient is able to leave the hospital in the shortest period ever, and to live a very happy person. Because most patient comes to the hospital not because they are actually sick. Most patient comes to the hospital because of mental, psychological issues that is disturbing them, and all what they needed is somebody to air out that problem. And if you are that one person, count yourself lucky. And if you don't give yourself that opportunity to be the listening ear, then you keep having patients that just needed a word and they go home and they are not fulfilled in any way and they come back. Do not forget, if you watch up to this moment, I'm your favorite girl, Nurse Aisha. Please do well, take few minutes to like the video, comment, leave a comment and subscribe to the channel. And if you are a returning subscriber, I want to say a big thank you. Please sit at the comment section and let's get to learn 1 or 2 things as it pertains to nursing and nursing students. 2, assessment of patients. And when we talk about the assessment of patients, we are talking about re-evaluation and the potentials of risks, the potentials of fall, the potentials of respiratory distress, the potential for bed adjustment. You realize that the person is having a respiratory distress and you need to adjust their bed. The potentials for readjustment of their bed so as to avoid bed sores. You realize that this individual is having a severe cough and there is a high risk for cross-contamination, so they need to be in an isolation room. When you have all this assessment, when you bring out all these conclusions on what is best for the patient came in with the temperature of this, and now the temperature is this. Is the patient progressing where? Is the patient at the level where their treatment is over and they responded well to treatment, they are strong now, they can go home? These are the assessments that we have to do as nurses to be able to say to ourselves at the end of the day, giving or writing a good report. So before you think of your report writing, these evaluations are what you come to play. You will now think of the fact that this individual, this patient needs to see a specialist. This patient needs to be re-evaluated by the doctor. This patient, I feel like the diagnosis is actually not the one that the patient is suffering from, because of your evaluation. If this individual was diagnosed for typhoid, treated for typhoid for the past 3 days, the temperature is still high, no stool, and the individual is still complaining of abdominal pain, then there is something wrong. We did not get the diagnosis right. There is need for re-evaluation. And you as a nurse, after you have completed this assessment, you pen down a report and you will relay this information to the next shift, or the nurses that are going to take over your shift, as well as you are going to relay this information to the doctors and to the specialists that are in charge of the patient, so that re-evaluation will be done and the individual and the patient can have a best and a good diagnosis, restructured and treatment readjusted, so that they can spend minimum time in the hospital having the maximum care, safety and quality services given unto them. So your assessment is very important. And this does not mean that the assessment will be done only by the senior nurse. You, as a nursing student, has every right to perform those assessments and come out with a very good report. We will come to report writing. After this, we will leave report writing. Number 3, care plan. We plan the care of our patients on a day-to-day basis. For those that are at my place of work, you are going to notice that on a day-to-day basis, in the evening, they plan for the care of the patients for the next day. Those that are doing the night shift do the planification for those that will be coming up in the morning to take over from them. So each day, you are supposed to draw a care plan for a particular patient. The drugs that they are going to take, the time for which they are going to take that drug. Those that are on wound dressing, when is their wound dressing supposed to be scheduled? Those that are for bed bath, when is their bed bath supposed to be scheduled? Those that will be trained for ambulation, when is that ambulation going to take place? The patient that needs to go in for echography, and when the echography will need to be carried out. Those that will be going out for an exam in another hospital, when that will have to happen. Those that need re-evaluation and assessment, how that re-evaluation and assessment will be done. So the care plan is a tool for a nurse to work with. Without your care plan as a nurse, what are you even talking about? It's like going to the farm without a hoe. It's like going to carry water without a bucket. It's like going to the market without money. So every nurse works with a care plan. Every hospital has a care plan made for each and every patient on daily basis. What treatment type are they on? When are the medications going to be served? Each and every one of these is planned. And we only go to the care plan, we read the care plan for a particular patient, and we know when this is going to be exhibited. A care plan for a malnourished child. A care plan for a patient suffering from malaria. What is to be done? Which medications are to be served? When are they to be served? A care plan for a lady that is for somebody that just had a CS. What is to be done? When is the bed bath going to be done? When are you supposed to do drainage? When are you supposed to take recording for Valters? When are you checking the BP? 15 minutes, 30 minutes, 1 hour? And what time are you supposed to check her pad? When to change it? So these care plans are one of the 20 things that we have to do as a nurse. Every nurse depends on it. It is your tool for work. If you are in a hospital where there is no care plan, people walk into the hospital and then you do something, there is definitely supposed to be a pattern in which you all work. When is the next medication? If it is not planned, then there is nothing you are going to do, because They say failure to prepare is actually preparing to fail. So as a nursing student, you equally have the opportunity to learn how to plan for patients the next day, to learn how to create a care plan for the patient, especially the level 200 students, especially for the level 300 students, level 100. It is in your duty to start understanding. They might not require much from you at this point in time, but it is an additional advantage for you to know these things. Number 4, drug administration. Drug administration is one of the most important aspects of the nursing role and the nursing career. The doctor prescribes and you serve. And for us to serve medication, every rule of drug medication needs to be duly respected. You don't just get up and you take any medication to give any patient. You need to respect the rules for drug administration. You need to check and double check before you go to administer the medication. And please, there are times or there are moments where you might make an error, because we all are humans. You might make an error and you serve the wrong medication to the wrong patient. Do not keep that away from your supervisors, from your mentors, from those that are training you. Please, when you notice, go to the supervisor, go to your mentor and tell them, I am sorry, the medication you just gave me now to give this individual, I have instead given to the other person. Because if you hide that information, you starve or you deprive or you cheat the patient that was actually supposed to get that medication, and you have served a medication to another patient that might probably cause a reaction, might probably cause harm to them, which if you had told on time, the senior nurse will rush in to counteract or to see ways, measures in which the patient that you are giving that medication, if at all, it will have any harm on them, so that they control that in time, as well as reserve the medication to the individual to whom that medication was meant for. Before you serve a medication, who am I giving this medication to? They say the male on bed 2. Male ward bed 2, and you enter the male ward and you cannot identify which of the beds is bed 2. Come back and ask the senior nurse, where am I supposed to give this medication, because I don't understand. Because sometimes, even though you are in the same room with the senior nurse and she is trying to attend to 1 or 2 or 3 of the students and giving medications to them, you might be giving medication to give to a particular patient and you change direction and you give it to another patient. Now, I am not an advocate for a senior nurse sending a student to give medication to a patient without direct supervision. That is to say that before a senior nurse sends you to give a particular medication to someone, let that senior nurse be with you and watch what you are doing. If I send you to give medications to someone, I will be there to be sure that you are not just giving medication to the patient that you are supposed to give that medication, but you are giving the medication in the right route. You are giving the medication the right way. Because they might give you IV medication and you give that medication IM. As well as they might give you an IM medication and you send that medication IV. Or they might give you a medication to put inside the drip and you pass it directly. So these are the 1,000 things that needs to be put into consideration. Before you go to administer medication, for your own safety, for the safety of the patient and for the safety of everyone involved, please ask your senior nurse, "Nurse, can you go with me?" When you get there, reassure yourself that you are administering the right medication to the right patient through the right route at the right time for the right reason. And when you are back, ensure that there was right documentation. The right of the medications is something that you cannot joke with, because it is going to guide you to be on the right path. You must observe every right. You must give your medication to the right patient. You must give your medication the right dose. The dosage of that medication must be respected. And that is why the very first thing that I teach my students is, before you get to the hospital, we must do drug calculation. And to those that are coming to the hospital, if you are in my team or any other team, the first thing to learn is how to calculate medication. You must calculate the medication you are about to serve. Is it the right dosage that is given to the patient? Number 3, you must be giving that medication the right route. If the medication is supposed to be given IM, it should be administered IM. If the medication is to be administered subcutaneous, that is what it should be administered. If the medication is supposed to be administered orally, give the medication orally. If the medication is supposed to be administered IV, do just that. The right route. You must administer the medication in their different paths. If you take artemether that is supposed to be administered IM and you give it IV, then well done. You just help to kill somebody's child. You just help to kill someone. Because they are going to die the very fastest moment. You are not even going to understand what is happening, because the reactions will just be out of this world, and before you know it, the story is truly finished. So you must be sure what you are administering, and you must be giving that medication through the right route. Number 4, the medication must be administered at the right time. If medications are meant for 6 a.m., they should be given at 6 a.m. Now, you might ask the question, what if the medication are given at 6:30? What if the medication are given at 6:15 or 6:20? What if the medication are given at 5:50? Because of the number of patients we have in the ward and the number of nurses, we might find a situation in which we start administering medication 20 minutes before time and 20 minutes after 6 a.m. That is still being within the range of time. Or 30 minutes before time, and we might finish 30 minutes after. Unlike a nurse who is doing a one-to-one care where they will give the medication 6 a.m. you give, 6 a.m. is done. But for us that have 50 patients, 20 patients, 40 patients in the ward, and we have 3 nurses or 2 nurses on duty, we need to start that care within a period, a range in which we are going to administer that medication, and it will still be okay. So medications have to be given the right time. If you have medications that are supposed to be served by 6 a.m. and they are giving it by 10, they are way out of time. And the patient's body or disease condition or bacteria has a potential to gain resistance to that medication. So please try as much as you can, save medication on time, assist, be an access wherever you are, and make sure that you are doing the right thing at the right time. When you have served the medication at the right time, number 5, it should be for the right purpose. And that is why on my previous video, I told you about the 10 tips in which you are supposed to understand before getting yourself into clinical placement. I will place the video somewhere at the end of this video so that you can continue and you get, in case you missed that video. You are supposed to already have a countdown of your medications and be sure of which medication, what the medication is used for, which dosage is this medication, how many meals are used to dilute this medication, what is the purpose, what is the use of the medication. And when you know what the purpose of that medication is and you serve it the correct way, respecting every rule for drug administration, you now go forth to do your right documentation. Because if it is not documented, it was not done. If you do all this and you do not document any part of it, it was not done. So it is very necessary that as you have finished doing this incredibly good job, please go in and document. If the senior nurse is the one to document, ask the senior nurse, I want to see what you are doing. How do we document these medications after we have already respected every rule for drug administration? They will show you and they will teach you. Double check. Make sure that you are doing the right thing. Check the patient. Go, come back, check the patient. It is okay to check 3, 4, or 5 times and do the right thing than carry it and go and give it to the wrong patient. We are spending 24 hours a day, 7 days a week, ensuring high quality care, safety, and delivering exceptional care to our patients is what makes up all the rules of a nurse in a healthcare setting. So it is that day to day. It is the fact that when everyone else is going home, you are in the hospital. If you are not there, your colleague is there. Or spending these 24 hours on guard, 7 days a week, rendering the highest level of quality care, safety, delivering our heart out to the patients, day to day, day in, day out, 365 days a year is exactly what makes the role of a nurse in the healthcare setting. So ensure that you are an access. Ensure that your presence, being there, is coming in as a fulfillment to yourself, to your team, and to the hospital at large, ensuring quality care to the patients, companionship, being a listening ear, taking care of their day-to-day needs that they are unable to, and bringing back and giving the best quality care to the patient in your best possible manner. Thank you so very much for being here. Thank you. I am here because you are here. As we grow, as we learn, I wish you the best in your internship, and I hope that as you spend this period of time trying to understand who exactly you are or who exactly you are to be as a nurse, may this be a learning period to you where you grasp every knowledge in the best possible way to make a difference, not just for yourself, for your community, for your family, and for every other person that comes across your care. Thank you so very much. This is Nurse Aisha. If you are washed up to this moment, I say thank you. If you are new to my channel, I say welcome. Please do well to leave a like, comment, and subscribe to the channel. If you are a returning subscriber, I want to say kudos. Thank you so very much for coming back. The love is unmeasurable. All right. Have a wonderful day and live a happy and a healthy life. Ciao.